This government meeting is brought to you by Eastworks and our local cable subscribers.
And the health order really details like a lot of the concerns that I had and observed and everything's dated too in the health order. So you'll see sort of like the progression of events. And it was extraordinarily complicated to come to the nuisance order on a municipal building for what you would think would be like a building commission topic. So I've learned a lot about HVAC systems recently and air quality.
Yep.
Against my will.
The target date is to reopen on the 14th. But it all depends on building and how fast and safely they can get things done. So,
yeah.
Do you have any questions, Beth?
No, I'll look for your email. I don't think I received it, so I'll look for your email on that. And it's too bad.
Yeah, it got kind of messy.
Yeah, I'm sorry I couldn't keep you more like apprised to the current situation. Just sort of been working like 12 hours a day to coordinate all of this. But I was glad we had a meeting here today. So I'm forwarding you the health order now that was sent out. I'm sorry you didn't get that through the list.
Maybe we should send it to Amy too.
Yeah.
Yeah, and I have to say, Allison has done a great job. So
thank you.
Yep.
Maggie,
Probably lost about 100 pounds.
Maggie's been like on my side and like there like almost the entire time, even with like our meetings with DPH and talking to lawyer, and talking to the mayor and DPW. So it's been a real joint effort, and I'm grateful, Maggie, to have you.
Yeah, it was kind of a rocky, wavy christening, I guess.
Yeah,
so
it was.
I felt like, why she can't do that by herself.
Well, I know, like I'm really familiar with the MGL as it pertains to like septic and like some other stuff, but not as it pertains to like nuisance and how like broad it is. So we made sure to talk to our the city legal counsel to make sure that we were doing everything properly and including as much detail as was necessary for the order.
Yep.
Okay. And the other thing too, Beth, that you should know is that we set up a health concerns reporting form for employees at the building because we had a good number of people reporting new symptoms since a lot of the work began, like respiratory symptoms, headaches, things like that. So I'm working with HR to filter those into occupational health services as needed, and also employee assistant program services as needed.
Great.
And consequently, when the state did come out, there were a lot of discoveries about the building that had nothing to do with this issue. So that's not the priority right now, but we can talk about those things later.
Yeah. Yep. Yeah. Maybe for the next meeting, I'll put on the agenda like a specific item on this, so we can like really go through it if we.
Yep.
If we want to. Well, hopefully the ordeal is like mostly over by then, but we don't really know. And okay, so a couple other updates from me. We will be having sort of discipline updates so the health department has the Healthy Youth Coalition, social work, public health nursing, inspectional services. So we have kind of a lot of different wings and a lot of people out doing a lot of things in the community. And I think it's a good idea for those disciplines outside of just Brian and I to come to the Board of Health meetings and provide updates on what services they're providing to the community, what feedback they're providing to the community, and to get the board's feedback as well in the work that they're doing. So I'm hopeful that this, at our meeting in a few weeks, the social worker, Liz Plouffe, is it Plouffe or?
Yeah,
Yep.
Plouffe.
Liz Plouffe will, I want to say Plouffe for some reason, Plouffe will be present to talk specifically about sheltering needs in the cold season this year, and some other community engagement stuff that we're working on right now together. And then we'll be also having the Healthy Youth Coalition do a pretty extensive report in a future meeting. I will say this is my first month on, and I'm still in the process of kind of like understanding and learning the programs and their reach. So this will be informational for me too. And yeah, there's a lot of stuff going on that I feel like the board should be able to hear about too.
Yep.
So that's the plan.
Also, has there been any updates on hiring the part-time inspector for Brian and a public health nurse? Like, where are we with that stuff?
Yeah, so that was my next thing. So
sorry.
no, it's fine, totally fine. I'm glad you're interested. So the public health nursing position was posted last week. So it's on the website. The job posting is up for 20 to 25 hours a week. It's a fully benefited position. So if you know anybody interested in getting into public health nursing, it would be a good position for them, perhaps. And the part-time inspector position. So the mayor, I met with the mayor a few weeks ago, and she did approve a part-time inspector for the department. So we will be in the process over the next month to just get a job description together. And Brian, I'll probably work with you to sort of formulate, you and Emily from HR, to sort of formulate what we want that position to, what we want in the scope of that position. There were concerns about a month ago that the position got bumped out of the budget, and there was just this like awkward period of between when Bree left and then when I came in, that the topic was sort of up in the air and just wasn't included in the budget that was shared out. But I've been assured that the funding is still there for the part-time inspector. And ideally, we'll be able to do enough documentation over the next 8 months or so to justify that position becoming full-time at some point, because I really think there's a need for 2 full-time inspectional positions with the city. I think there's enough food establishments, there's enough camps, enough, full bodies of water. Yeah. Brian can surely attest to that.
And as we'll find out soon, there's also enough flies.
Mm-hmm.
Yeah. I've almost, that topic feels like ancient history to me.
I know, doesn't it? It's so funny.
Yeah. And that's pretty much it for my updates.
Okay, good. Right on track, even though you had a blip.
Yeah.
Okay, next is you're up, Brian.
And he just left.
Yeah.
Hello.
I don't know what happened. We'll see if he comes back on in a minute.
Yeah. Should we skip to the Federal Street, or do we need him for that too?
Let's wait. Yeah, let's wait for let's give Brian just a few seconds
Yes.
to join us. There he
So
is.
there-
Okay.
We lost you.
Sorry, yeah, I don't know what happened. My computer just kicked me off by itself. I didn't even touch anything.
So
Has it moved to my update yet?
yes, it has. Yep.
Okay. So I don't have too much to go over. I just highlighting kind of what's going on in my realm of our department. So just a quick, some of like the highlighted things. So obviously last meeting, we talked about 140 Everett Street. That was the property that the city recently became in possession of due to unpaid taxes. And I had to condemn it due to hoarding and animal hoarding. So, so the process has moved along with that. All of the cats were removed as of like a few weeks ago. And the city actually had a cleaner already clean out the house. I don't know how extensive the cleaning was. I know that they probably mostly just got rid of all the junk and trash.
Yeah, there was a huge dumpster.
Yeah.
Yep.
So that's moving along. I know that's scheduled to be sold by auctioned and sold by this the city at some point this month. So
Yeah. Below.
yeah, actually, it's funny. Johnny, the owner from Nini's, is expressing interest in it. So I actually spoke with him on the phone yesterday about it. So
He buys properties and fixes them up and rents them out. Yep.
yeah. So that's it for 140 Everett Street. I'm getting into the end of my camp season, so I'm pretty happy about that.
Yeah.
Yeah, as of next week, I have a re-inspection for one more camp on Monday, and then we'll be done for the season. So
Yay.
yeah, we had a total of eight camps this year. Yeah, 5 of them, 4 of them were at Williston, and then the other 4 are, the regulars in town. And then just a quick reminder, I also wanted to check in with Jackie too. Union Mart, their permit. Okay, good. So he did pay. His fine was paid. It was received earlier at the beginning of this week. And his permit suspension, his 3-day suspension goes into effect Friday.
And I did send the email to Kelly. She responded. She'll let Donna know about both him and Old Colony.
Okay, excellent. Yeah, and when I spoke to him on the phone about the payment, Jackie, I did let him know that I reminded him that no tobacco product is supposed to be in his store. So hopefully that's the case. That'd be nice if they're able to get somebody out there. And then staying on the same category is Union Mart. So on July 20th, we received a letter from MHOA, which is the Massachusetts Health Officers Association. So they do tobacco compliance checks as well, as part of a contract that they have with the FDA. So they sent us a letter stating that they did an inspection, a tobacco compliance inspection, and they
At Union Mart, yeah.
they observed a violation as well. So it's
After the first one?
a different organization did a compliance check and observed the same violation. Yeah, on the letter it does state that no action is needed by the board or the health department. The letter just serves as a heads up to us that they did a compliance check and and they found an issue. So I don't know if we can communicate with like Pioneer Valley Tobacco and kind of put that on their radar, and so that way, they might want to do more spot compliance checks at that location since they're having reoccurring violations. So
yeah, I don't get the sense that he's really going to do anything because he wanted us to do it. So
yeah, I know. I know he's so focused on the firing of his employee, which is obviously we don't, there's no legal requirement of that. So moving on, just kind of getting it back into food inspections, which is good. Those have been kind of neglected, unfortunately, for the months due to like camps and all of the condemnation stuff, and we've had a lot of nuisance complaints in regards to overgrowth, trash, standing water. We have unused above ground pools that have been filled with water that are like breeding grounds for mosquitoes, and so that's kind of what I'm dealing with right now. Yeah, I think that's all I got.
Was there any further follow up on the Dynasty Gourmet situation?
Oh yes, so well Tong Sing is the Chinese restaurant that we recently had a complaint filed on by the fire department. And
I think Beth is talking about the food poisoning. The
oh
Yes.
yes, oh yeah, sorry.
Was it Shigella?
One saying is a different.
Yes, yeah. So
there's been a few.
so we had our extra inspector Chris Majewski go out there. She went out there just I think within a week of the last Board of Health meeting when we spoke.
I think it was the next day.
Yeah,
I talked to her the night.
Yeah.
So she went out there, and from what she observed, she didn't observe any issues. Shigella is mainly passed on through, person to person, whereas it's typically not transmitted through food. So she did bring up, she did speak to, she told me she spoke to at someone at the state lab that does the testing and everything. And there was roughly 3 weeks in between the consumption date of Dynasty Gourmet to the test date of when testing for Shigella. So at her opinion, she didn't think that it originated from Dynasty Gourmet because there was such a long period of time in between the consumption date and the test date. So so that's it for now. For the Dynasty Gourmet one, I do know that our fire inspector just recently went in and 2 different Chinese restaurants in town, and both of them weren't the greatest. I know the worst one was Tong Sing in his opinion at the time, but he did mention to me that I should probably pop into Dynasty Gourmet. So I'm kind of curious to see. I plan on popping out there to just not do necessarily a routine inspection, but just to focus on Dan's complaint in regards to like grease buildup and stuff like that. But I just did an inspection of the other restaurant, Tong Sing, today. And they did have some issues, but nothing majorly concerning. So I'm just following up with them in about a week or so.
Okay. Chinese
Oh, and
food.
I'm sorry, I forgot one thing for the health update or the health director update. We are in the process of working with the regional the Public Health Excellence Regional Nursing Service, Lauren Davin, and then Chief Norris with the fire department to get 3 flu clinics scheduled for the fall. So we'll do one that's like a full townwide drive-through clinic. We'll do a municipal clinic, and then we'll also do one at the Council on Aging. So I just wanted to let you know that we're in the process of picking dates for those, and they'll be generally through October and potentially into early November, but trying to get them all into October.
Okay. And what about, they haven't come out with a booster yet. Never mind.
I know. So I know that Northampton, since they order the vaccine on behalf of us, their preference is to keep COVID booster clinics and flu clinics separate because the registration process and the registration process is really complicated, and you'd have to register people for 2 different things for a single appointment, and it's extraordinarily complicated. So we will work with them once the new booster is available to have a specific 1 or 2 COVID booster clinics for the city.
Did you ever find out from them, when we met that first time and where we were paying?
She wasn't here at that meeting, I don't think.
To what? No,
Was she
just
out?
Allison and I met.
Oh, sorry.
That's okay. Do you want to fill Beth in? Just
Sure. Yeah. So I was just asking questions sort of out of curiosity of process when I was closer to starting this position a few weeks ago. And a question I had floated by Maggie and also Bridget, our public health nurse, before she left, was if Easthampton was ever on the receiving end of any of the vaccine reimbursement for COVID or flu vaccines in previous years. And I also discussed this with the mayor, and so Easthampton hasn't received any vaccine or reimbursement through Medicare, Medicaid, or private insurance. And the reasoning behind that, I guess, is that Northampton orders it, does the cold chain management, and then brings it to the city. But the reimbursement is based on like the number of vaccines given at the clinic. And oftentimes it's fire department paramedics, or at the time when Bridget was still working, Bridget doing injections. And so I brought up the question of whether or not we could work with Northampton to, at some point in the future, start receiving some of that insurance reimbursement money so that we could help support the public health nursing position in the city. With that, it's like, depending on the insurance, and COVID and flu, it's somewhere between like $30 and $100 and something per dose that's given. And in, the public clinics that Easthampton does, especially the big townwide one, I think Bridget said there was somewhere around 400 people who got a vaccine, and then a few hundred, she might have said it's close to 1,000 that were done between COVID and flu last year. So you can imagine if you average it out like $50 to $75 per dose, it's quite a bit of money that was reimbursed to Northampton for the vaccines that were given in our community by providers here. Of course, the administrative side of it and the cold chain management side of vaccine storage do cost money. So I would never expect 100% of the vaccine reimbursement, but that is a conversation I want to have at some point.
Okay.
Sure. Yeah.
Yeah, you haven't had time yet. Okay.
Yeah. Sorry. I
No,
haven't. It's really been on my mind though, because like the part-time inspector that's coming up, I would really like to have the public health nursing position be full-time. That was the primary reason Bridget said she was leaving the position, is that it was part-time, and it's hard to make that sustainable for anybody in a really long-term way, to not have an option for full-time employment. And I think that is the case for a lot of people looking for positions right now, is having like full-time benefited positions where they're not splitting themselves between 2 or 3 jobs.
Yeah.
So if we were on the receiving end of some of the vaccine reimbursement that we do with our clinics, that money could certainly
help
the nurse up to full time. That was my thinking, sort of, and the urgency to have that conversation.
Great.
Yeah.
Sounds good.
Did you have anything else, Brian, or were you all set? I forget. You're good. Okay, the last thing on the agenda is the Federal Street slide. I don't know that Beth is aware of that because she wasn't. Well, nobody would be, because it was just without Amy or Beth that we talked about it. So,
yeah. Brian, do you want to start? Do you want to just go over the
Yeah, yeah.
rate of it and the history?
Yeah, absolutely. So it's the property's 26 through 28 Federal Street. It's a two-family, like duplex home. The owner was living on one side, and there's a younger couple on the other. The owner of the home passed away, I believe, back in January. When she passed away, it went into like a legal limbo. There was no next of kin to claim the property, or nobody wanted to claim the property. I believe there are siblings, but no family wanted to claim the property. And so it kind of went into this weird legal limbo situation where Florence Bank was kind of like overseeing the property, but legally they weren't, like in full in possession of the property. So back in, I believe it was the end of June-ish, maybe beginning of July.
Yeah.
We got a complaint from the younger couple that lives in the unit next to the vacant one, and they had a complaint about significant amount of flies in the vacant unit, and that the flies are making their way into their unit. So I do know that the previous owner, she did have a history of hoarding. The last time I was in the home was back in January, shortly after she passed. The home is unsanitary. It is, cluttered. There is a lot of junk. And I'm sure at this point now, because of the flies, there's food or something else that's, rotting away in there. So I did do an inspection, and I didn't go into the unit, but the flies were very visible from the windows and the front door. I roughly saw at least 30 to 50 flies on each window. So my guess is there's probably hundreds to thousands in there, just because they can breed so quickly and fast, and especially, maybe not this week, but recently, it's been hot and humid, and that aggravates the whole situation. So, once the inspection was conducted and I saw that, we tried to figure out how we can move forward with putting an order on the property to get this fixed. I originally initiated doing an order on the bank, but then after communicating with our city attorney, Ryan O'Hara, and he communicated with the bank's attorney that the bank was considered not in possession, and as of right now, there really is no owner to cite. So I do know that on July 20th, it was auctioned. I believe it was July 20th.
Yep, it was.
Yep.
It was auctioned, and I do believe that the closing date estimate's roughly a month.
I think August 20th is the date.
Yep. And I know I've been kind of going back and forth with the attorney, myself, the attorney, Allison and Maggie all did a conference call. And the attorney, he essentially stated there's two options at this point. The first option is the Board of Health can, in situations like this, can kind of take over and end up, setting up the pest control, paying for the service and stuff like that. But there is a list of legal requirements for that. There's public posting, there's public hearings. So it's a whole thing that would probably get dragged out maybe a month plus. And then the other option is to wait until the house fully closes and to put the order on the new owner. And I know that the attorney was favoring in that. He said obviously ultimately it's up to the board, but he seemed like that was the best approach. If you had anything
And then
to add,
there would be likely more time efficient and cost efficient for the city. Unfortunately, with either of the options, the tenant still is in a
That's
sort
the
of like
way.
waiting
Yeah.
period to get the nuisance or the pests controlled.
And hopefully whoever the new owner is will respond without us even, but we should, give him a call like on the 21st.
Yeah. Yep, for sure.
I did get all these emails, so I did know about this situation.
Oh, okay.
Just so you know, I am getting some emails. So is the owner like gonna come back at us and be like, "What? No, I'm not doing this." Like, or is it sort of?
I mean, the odds are, they could. But I'm hoping in a situation like this, when when people buy houses like this that have active, issues with the health department, hopefully, they'll comply and fix it right away. Ultimately, if it doesn't get fixed, the state housing code states that it falls back on the owner no matter what. So
Yeah.
if they're the listed owner, they've taken over that problem. So if it gets to that point, if they go back and forth with us, I would most likely just take them to housing court, and a judge would just tell them that the law is the law.
And I have a feeling it's like they're going to have to clean out that side of the house. So the only thing that, we need to make sure that they have some kind of pest control place come and look after they've cleaned it out, because we need to, where's the source and is that appropriately dealt with?
Yeah, it'd be good to maybe have them, have the pest control come out initially, and
Yep.
then do like a follow up, or
Right.
staggered appointments where they would come in and occasionally check to see how things are.
Yep. So it was on the agenda because we thought we were going to have to vote on paying some money to do all this, but I mean, I guess we should vote on what we need, what we want to do as a board.
Yeah. I would take a vote on what
Yeah.
option you would like to have us take action with.
So I'll make a motion to address the Federal Street property with the new owner once the closing is completed on the property, and take appropriate action depending on response from the new owner.
Okay.
I'll second that motion.
All in favor? Maggie, yes.
Beth, yes.
Okay.
I can too. What I'll do is I'll reach out to the bank. I'll see if they can provide buyer information. I don't know if that's, if there's legal things to that, but if they're able to provide buyer information, it would be good if I can connect with them before the closing, so that
Well, I think Ryan advised against that.
he did.
because
Okay. All right.
First
Yeah, we
of
don't
all,
want them to like back out.
Yeah.
That is true. Yeah.
I wonder if we could just prepare a letter, Brian. I don't know if we can include something as in like the closing packet, or maybe we do have to wait till it's like fully closed.
Yeah, I think we need to just, we can't do anything until the person is officially the owner.
Yeah.
And then I think it would be appropriate for Brian to have a conversation then and make him aware that the tenants have filed a complaint, and because of the limbo state, we couldn't really go forward with anything, and then just say, these are our recommendations. What do you think?
Yep.
And then go by that. Okay. Anything else that is not reasonably anticipated?
What
I have
has it
nothing.
been? Yeah, sorry.
Yeah, City Hall closed for 4 years. No.
Well, the health department's in a little bit of limbo because we didn't immediately get a satellite place to work. We will have workstations set up at the Council on Aging. It was
Okay.
supposed to be by today, but I am not sure if it's been completed yet. But so we're all sort of working in like temporary offices and
Yeah.
from home primarily right now.
Okay. All right. I'll make a motion to adjourn the Board of Health meeting of August 2nd at 6:16 p.m.
I will second that motion.
All in favor, Maggie, yes.
Beth, yes.
This government meeting is brought to you by Eastworks and our local cable subscribers.